I will now invite Mr. Yogesh Nathadwala, consultant orthopedic surgeon, to introduce our next speaker, Dr. Frank Atherton, who will discuss how our health was protected during the first phase of COVID-19. Yogesh?
Dr. Frank Atherton is very well known to us, advising an update on the COVID and setting a personal example of a sacrifice at Christmas. He is our Chief Medical Officer and Medical Director, NHS Wales, since August 2016. Frank graduated in medicine from the Leeds University and worked in a hospital and primary care setting for a number of years before doing a voluntary work as a district medical officer in Malawi. On his return to the UK, he completed the specialist training in public health medicine and then worked on the international health and development issues for WHO and the UK Department of International Development in various locations, including former Yugoslavia, Tanzania, and Bangladesh. From 2002 to 2012, Frank worked as the Director of Public Health in Lancashire, and from 2008 to 2012, he also served as the President of UK Associations of Directors of Public Health. In 2012, Frank moved to Canada to take up his post as a Deputy Chief Medical Officer. Let us welcome a long-standing friend of BAPIO, Dr. Frank Atherton.
Thank you very much, Yogesh, for that very kind introduction. Thank you very much. What I wanted to do today was to really, first of all, thank BAPIO, because this is the opportunity for me to launch my CMO annual report. And in fact, I delayed the launch of this specifically because I couldn't think of a better venue than the BAPIO conference launching. So thank you very much to Keshav for giving me the opportunity to use this venue. And what I'm trying to do with this report, which actually has just gone live 10 minutes ago, so I'll give you the web link at the end, but what I'm trying to do is two things. First of all, I felt it was really important to document some of our response in the first phase of coronavirus, and then more importantly, to use this as an opportunity to learn the lessons, because we as doctors, we as health professionals, of course, we have a professional duty to reflect on our practice and to understand the things. And if we don't understand, what's happened in the past, we cannot plan better for what happens in the future. Just a quick timeline, and it's amazing to think back and to remind ourselves that it's only exactly a year ago, in fact, today, that the World Health Organization declared COVID-19 as a public health emergency of international concern. And of course, the first case here in Wales was on the 28th of February. What a year it has been for everybody. It has dominated many of our lives. And in the whole of that process, what I've seen and what I've been delighted to see is that despite all the ups and downs, despite all the difficult fights we've had with this virus, we have had an effective coalition, I believe, of politicians, of clinicians, of the public working together. And I think that's the only way that we can continue to battle this epidemic. Another really important feature has been the reliance on evidence. Now, evidence is always contended, evidence has evolved as the pandemic has unraveled. But by and large, in Wales, we have taken an approach which is to look at the evidence and to try to match our responses to the evidence. Now, we can look back, and I am looking back in the report and looking at, well, what could we have done better? What could we have done better had we known more about the virus? But it is that learning point that I wanted to stress today, that we have to learn the lessons of the past. And I'm going to come on in a moment to some of the recommendations, because those are the things I think we need to do going forwards. But I do need to pause at this moment just to kind of reflect on the effectiveness of our health and social care environment. Many of our colleagues have been working flat out through this pandemic. Our thanks and our appreciation has to go to them, both in health and in social care. We know we've lost friends and colleagues. We all have, during this pandemic, and we must never forget the sacrifices that have been made on our collective behalf. One of my key recommendations is really around preventing future pandemics. We are immersed, absolutely immersed in dealing with COVID-19, but we've had pandemics before. We've had outbreaks and incidents here in Wales. We will have issues in the future. And so we really need to learn the lessons from now so that we can both predict and prevent damage from future pandemics. And one of the framings that I've been very impressed with, and which I think we need to use more systematically here in Wales, is the One Health agenda. So we need to look not at human health in isolation. We have to look at human health, animal health, and environmental health, all as interacting. And this is the concept of One Health. Some people would refer to it as planetary health. But if we use this framing, we can not only use it to deal with COVID-19, we can use it to deal with some of the other really fundamental problems we face. Antimicrobial resistance is a key one that it's already been applied to. But we also need to think about, the big challenges of climate health. I'm reminded, just at the moment, we have an outbreak of H5N8, N5H8, H5N8, avian influenza up in Anglesey. And, it's another example of where we need to apply this type of framework. One of the strong themes that I do include in the report, and it's a theme of today's BAPIO conference, is the one around inequalities. It is a fact that the pandemic has affected different members of society and different groups in society differentially. That's true of deaths. If we look at deaths, deaths have been more concentrated in people living in crowded conditions in poorer communities here in Wales. If we look at the economic impact has fallen hardest on those who are poorest, who have lowest incomes. If we look at the social impact, taking, for example, schooling and education, it's the kids in poorer communities who are less able to manage online learning, to move to online learning, who have suffered the most. And we must never forget that there are groups in society who are extremely disenfranchised, homeless people, people from asylum seekers who really have suffered the hit much more than the general population. So we need to, as the First Minister put it very eloquently, I felt, not just build back from coronavirus, but build back better and build back fairer. I do need to say something about, the impact on people from Black, Asian and minority ethnic groups. I won't dwell on this because previous speakers, Professor Iqbal and Heather not least, have spoken eloquently about this. But I am proud of the work that we've done in Wales to recognise the risk to people from those communities and to be able to share the work that we've done here in Wales around the risk assessment tool and our move towards the development of a more fulsome race equality action plan. They will be cornerstones to building back fairer. We are moving to a new normal, and one of the criticisms I faced repeatedly in this pandemic, and government has faced, is that we've focused, of course, entirely on deaths. People make this claim. We've tried very much to balance the harms from COVID. We recognise the immediate direct deaths and damage that is caused by the virus, and we've all been working very hard to fight that. But we mustn't forget that harm also comes from the pausing of NHS services. We need to get them back online and get them back online soon. There is harm that comes from that. There was a fundamental harm that we were at risk of here in Wales and across the UK, that if the NHS had become overwhelmed, we would have seen very significant damage. We didn't get to that point in the first wave. We didn't get to that point in the second wave, but we came far too close. And the fourth harm, the one about broader societal impact, we still have to see the impact of long COVID. We know that those economic pressures that we're facing, that those social issues of kids not being able to go to education will have long-term harm. And part of the challenge going forwards is to better quantify those broader harms and to use this framing of the 4 harms to manage our pandemic in the next few months. So just quickly on the recommendations, and I'm making 8 broad recommendations. The first one, of course, is that we need to focus on our health protection services. In fact, here in Wales, we'd identified this the year before COVID struck us, and we had the Minister of Health and Social Services, who is speaking later, had made some investment in that to improve our laboratory systems in particular. That was wise, that was timely, but as ever, that we need to go further on that. So building our health protection capacity is really important. Secondly, we need to look at our response systems, our case management systems. We weren't as fleet of foot as some other countries, some other European countries even, in getting started with our case management. We need to have that ready on the blocks for future pandemics. It's an obvious point that we need to apply everything we're learning from this pandemic. There have been some positive things, and we need to take those and apply those. And Andrew Goodall mentioned some of those things that we mustn't go back on. We must use that in terms of future health and social care delivery, but also in terms of planning for future pandemics. The engagement I've already mentioned, this cannot be done by government alone. Let's be very clear about that. We need engagement of citizens. We need engagement of our workforce, of our health and social care colleagues to be able to deliver on this kind of an agenda. I've already mentioned the One Health approach. I think that will be a very useful framing for us to tackle the current crisis that we face, but also the crises of the future. And I've also mentioned our health and social care response and how important that is and has been and will be going forwards, that we need to build and strengthen that. This is a time when health and the NHS, we should be really proud of what our colleagues have done, but we need to celebrate that, and we need to look at the sustainability of our health and social care systems and how they connect properly together. And the 7th recommendation is around monitoring. We have to monitor our inequalities. We've gone a long way towards that in Wales. We do have a collaboration with the World Health Organization around this, and we need to use that to monitor those inequalities. One of the big lessons for me is that our health status was not good going into this coronavirus. And as I think the First Minister mentioned earlier, coronavirus has exploited those vulnerabilities and has exacerbated our inequalities. It has found our weaknesses. So we need to build back better by tackling those inequalities across the broad swathe of society. And that, as a public health physician, is what I'm all about and what I think we need to do going forwards. And finally, I do need to mention research and development, because I think there have been some really important success stories in this. 2 that I would cite. We have a very good record on genomics here in Wales. We've done more genetic analysis of COVID specimens, I think, than most, if not any other country. 22% of our specimens going through Welsh labs have been analysed. That allows us to get on the front foot. And secondly, we have participated in the vaccine development, which is the part of the route map to getting us out of this terrible position that we find ourselves in. So research and development, critically important to finding our way out of this pandemic. So there's the web links to the report. I will put them in the sidebar so you can copy and paste them. I hope you'll go and read the report. There's an awful lot in there. It's getting a lot of attention. I will have to drop out this afternoon to do some further media work around that. And I will try and flag BAPIO, because I am absolutely proud to be here with you, as I've been at every BAPIO conference since I was fortunate enough to come here to join you in Wales. And I will try and name check you, because I couldn't be more delighted than to use this as the opportunity to present my CMO report. Thank you very much, colleagues, and I look forward to continuing to work with you as we manage our way through and out of this pandemic. Thank you.
Thank you, Dr. Atherton. We are honored that you chose our conference to launch your special report. It was fascinating to hear how the lessons learned from COVID-19 will actually help us to respond to future health crises. And I think almost certainly, I think we will respond better. I now invite Mr. Atul Gaitonde, orthopedic surgeon, to introduce our next speaker, Professor Pushpinder Singh Mangat, who will discuss the collaboration between HEIW and BAPIO to facilitate international recruitment. Atul.
Hi, good afternoon, everybody. It's my privilege to introduce Professor Pushpinder Singh Mangat. Born in India and came to UK at age 2, son of the first Asian headmaster in the UK. Push did his medical education in Birmingham before starting as a medical SHO in Llanelli, where he managed to ventilate medical patients on medical wards in days where there were no ICU. This led to his future life in Wales in his new specialty of intensive care and anesthesia. He was the first Asian consultant appointment when he was appointed as a consultant in Morrison Hospital in 1994. This followed a long career in clinical and medical management. He was Deputy Medical Director at ABMU Swansea prior to becoming Medical Director at HEIW and Honorary Professor at Swansea University. Push has particular interest in addressing inequalities faced by SAS doctors and contributing to the Welsh government-led Race Equality Action Plan steering group, particularly in addressing differential attainment. I invite Push Mangat.
Thank you very much for that very kind introduction. I'm just going to share my screen, if I may. Can you all see that? Okay, let me go to slideshow. So thank you. I have to say, Pranam Dar Pawb, and also like to add to that, Salam Alaikum, Namaste, and Sat Sri Akal to all our distinguished guests and people who are attending this conference. So that's me. That's I've been introduced as the Medical Director of Health Education Improvement Wales, which I've been in post since 2018. Today, I'm going to talk about one of our roles in alongside BAPIO in trying to address some of the workforce challenges across the UK and in Wales in particular. So we're going to talk about BAPIO's role, our role in global engagement, Train Work Live initiative, a future shared agenda and working. So if I go on to the next slide, this is what BAPIO has already done, and I have to say that what BAPIO has done in Wales on recruiting doctors from India to come to Wales and work is nothing short of astonishing, really. They were established as part of the All Wales Medical Workforce Group back in 2015, I think it was. I sat on the same committee that Kesh was sitting on to start this initiative. And since then, there's been a well-established process that has developed over those years. Hundreds of doctors have come to work in Wales, filled many, many vacancies, and saved the Welsh NHS millions compared with equivalent locum costs. And that's only based on the locum costs where the capped rate is applied. We know that locum costs are much higher than that in Wales when you can't fill them through established arrangements with locum agencies, and I think that the savings have been a lot more. What's more, they've established links with institutions in India, and a lot of those things are going to be talked about later, and facilitated political links as well. So I think BAPIO have got a lot to be proud of in this initiative, and we're really grateful within the Welsh NHS for the work that they've done on that. What about HEIW? Well, we came along in 2018 in October, and we are the strategic education body for Wales. We're the youngest of those in the UK. NHS Education Scotland has been in existence since 2005. NHS in England, Health Education England has been established for over 10 years now. So we've been in existence for 2 years, and we have slightly different remits to the others in the sense that we've got improvements as part of our remit. And these are our strategic aims. Obviously, it's important for us to be delivering on a workforce, having an excellent education training program, not just for doctors, but for many other professionals, and for undergraduate education for most of the health professions that work in Wales. Capability in leading, and particularly on the compassionate leadership and compassionate agenda that has been touched on by Professor Iqbal earlier, and supporting quality and safety. And that is essential, that we don't just provide the workforce for the workforce sake, but actually provide it to give a high quality and safe service. And we like to be considered as an excellent employer and a great organization to be worked in. And we hope that we're a trusted partner and system leader. So that's a little bit about Health Education Improvement Wales. What's our role in international recruitment and global engagement? So back in, I think it was now early part of latter part of 2019, early part of 2020, we created a function within HEIW and appointed a lead within HEIW for SAS doctors, for international medical graduates, and for global engagement. We already take part in an initiative alongside Health Education England, where we support global health fellowships, particularly in Africa. We also have links with the HE International Recruitment Department and Global Health Initiative there. Although I have to say, I would rather make sure that we have a specific focus in Wales. We created an SAS Doctor and Global Engagement Advisory Group, and BAPIO had a seat on that, and Kesh was attending that when we were doing that. And that was progressing well, I have to say, and it was bringing together representation within Welsh Government and Wales with similar portfolios to ensure a coordinated approach across other countries. So this brought together, as I say, BAPIO, Wales for Africa links, Public Health Wales, who have a big international linkage department, and other existing international links were being developed. And we thought we were on a good strategy there with all of this. And the reason for international recruitment is a slide here that some of you may have seen me present a couple of years ago. And that is, junior doctor rotas are always short of individuals. And at the moment, we always concentrate on the deanery trainees. Well, whilst deanery trainees are important, and I don't for a moment want to think, imply that they're not, all of these other groups who fill the junior doctor rotas are very important too. After foundation, a lot of doctors decide to have time out of the training system. I call it the foundation fall off. And I think it's really important that the Welsh NHS provides distinct opportunities for that. But also existing SAS doctors, as many of you in the audience I recognize are, they also require support. And we're one of the few deaneries that already has a deanery for SAS doctors here in Wales. But international medical graduates and foundation fall-off individuals are all in sort of SAS roles or locally employed posts. So I think it's really important to realize that all of these individuals also need the same support and the same development as deanery trainees get. And if you get that, I suspect we're in a better position for filling in rotas and saving money. And when you fill rotas, lots of things benefit from that. People work together better, more people have educational opportunities in theatres, outpatients, and the like. And I think that it breaks down barriers and improves respect in between these groups, because I think there's occasions when this group is seen as the elite. So I think there's lots of benefits from recruiting internationally to fill some of these roles. It also improves the links with these institutions where we go to and we work with, and equally we can provide opportunities for some of these doctors to actually go there and get experience too. So that is the global engagement agenda that I think HEIW has a role in. So As I said, we were heading in a good direction, but unfortunately, two things happened. First, the lead that we appointed decided to return to his previous a clinical role he'd held many years ago. And also COVID-19 hit us, and all of our attentions in HEIW were focused on supporting the NHS in dealing with the response on the front line. So we were forced to pause this initiative from March last year, pretty much until now. So so there have been good things have happened recently on that. We've got a new lead appointed for SAS doctors and international medical graduates, an individual called Ian Collins, who'll be known to many of you. His background is psychiatry. A second thing is that the Train Work Live initiative is moving to HEIW. And part and parcel of that is engaging with our international colleagues and engaging with them in a way that we can have a ongoing relationship with them and with their institutions to both bring people over here to train, work and live, not just in medicine, but in other professional areas too. We have resumed the Global Engagement Initiative, and we'll be shortly sending invites out for the new meetings. We have also implemented a differential attainment board, which some of you are aware of. Very important part of the discussion. It was mentioned by Lord Kakar earlier that we have some real issues in differential attainment, progression and referral. And that part of that work that's going on there would have a beneficial impact on any issues that international graduates had when if they came over to us. So it's really important to implement the work that's being done there into the care of international graduates when they come to this country. The other thing that's happened is that doctors are now on the shortage occupation list, which has actually encouraged deanery recruitment as well, increased deanery recruitment as well in Wales, which is something that is not always guaranteed. So that has been a real benefit to us. And lastly, we've implemented a single lead employer model for doctors that is going to be phased in over the next 12 to 18 months. And that gives us the platform for any doctors who come to Wales to work to have a single lead employer arrangement, which simplifies the ways that we would be able to educate them, potentially rotate them, and to work in appropriate parts of Wales for their needs. So all of those things I think are good, and I think they will benefit international recruits when they come to us in the future. And as I said, we've got increasing numbers of IMGs applying for foundation, core and specialty training. But we will still need MTIs and the other working visas allowing doctors to come to us here in Wales. So yes, important to mention Train, Work, Live. It's a worldwide engagement, not just about recruitment to Wales. It's about engaging. And putting Wales on the map as a good place to be, I think, is a really, really important thing for us to be harnessed into. It is multi-professional, so it applies to other professional groups as well, and it has Welsh Government backing, as we know. What's our shared agenda? Well, we already did collaborate in 2019. BAPIO kindly allowed HEIW to accompany them and observe the two-state visit to India in November 2019. It was linked with a cabinet secretary visit. I'm sure you'll hear about that later. And it was clear that BAPIO had established excellent links with the key institutions and the state systems over there. And as a facilitator for anything that we might want to do in India in the future, I think it is really important that we work with them. It was lucky that on occasions, HEIW staff were able to assist the BAPIO team on an ad hoc basis with some of the recruitment. But it was really important, I think, that we learned a hell of a lot, and I think there's plenty to be done in the future. Where can we work together? I think there's real opportunities for us to work on streamlined systems of application, shortlisting, selection, and appointment. And if it's done between us, then we have the overarching governance of HEIW that will support this process. use existing systems, and if necessary, modify them. We have an issue to address about having GMC sponsorship here in Wales, and that is something that really slows down the arrival of international graduates into Wales and into anywhere in the UK as it happens. And I think it's important that we work with BAPIO to make sure that that happens for those doctors coming from India. But of course, for us in HEIW, it'll be important for implementing recruitment from elsewhere too. And I remember the days when I first started clinically that there was numerous contributions from Australian, New Zealand, South African, Canadian, and other Commonwealth countries into the workforce here in Wales. So I see BAPIO as a key future partner, both in international recruitment and global engagement. And it's consistent with the Welsh Government and HEIW Train, Work, Live campaign. So looking forward to that. And having had a conversation earlier about an MOU, it makes sense for us to be thinking about an MOU as well. So diolch yn fawr, and any questions? I will leave the final slide briefly on how to keep in touch with us. And thank you very much for inviting me to speak today. It's been very humbling listening to the other contributions, and I look forward to the rest of the conference.
Thank you, Professor Mangat. BAPIO is very grateful to HEIW for working with us to benefit NHS Wales and to attract international medical graduates to work in this lovely country.